Hello everyone, welcome. In this video, I'm going to be talking about collagen and if, or if not, it has any effect on knee osteoarthritis based on a newly released study. I'm Valerie, lifestyle nurse and osteoarthritis wellness specialist. It is my mission to empower those living with osteoarthritis with science-based information so that they can improve their symptoms, slow or halt the progression, and live their best life. So I want to start out by saying that no single supplement is the best way to manage osteoarthritis. Lifestyle strategies like eating the right diet, getting in regular movement, and other strategies that I've talked about on this channel should be the foundation of any management plan. But I do get so many questions about supplements, especially collagen. And supplements can play a supporting role along with lifestyle strategies designed to improve osteoarthritis. And also, collagen is very misunderstood. So when this meta-analysis crossed my desk, I thought it was worth sharing with you all. This study examined the use of collagen supplements for knee osteoarthritis. It is rather complicated, so I want to break it down in a way that's easy to understand. This study examined two different types of collagen, so I will also be talking about the important differences between these two different types, hydrolysed collagen and undenatured collagen, and why they are not the same thing. This is very important information to know before choosing a collagen supplement. The study that we're talking about is a type of study called a meta-analysis. This is the strongest type of scientific evidence available because it takes data from multiple clinical trials. In this case, researchers looked at 11 randomized controlled trials involving 870 participants and pooled that data together to see if collagen supplementation can improve knee osteoarthritis symptoms like pain and joint function. So the main takeaway from this study was that collagen supplements did lead to improvements in both pain and function. But there are some important details you need to know before you go adding collagen to your cart. Let's start by learning what collagen actually is and how it works. Collagen is the most abundant protein in the human body. It's like the glue that holds everything together, providing structure to our skin, our tendons, ligaments, and most importantly for osteoarthritis patients, our cartilage. Cartilage is a smooth, rubbery tissue that covers the ends of our bones where they meet at the joints. It protects our bone ends and helps the joints move smoothly. But with osteoarthritis, the cells in our cartilage begin to overproduce enzymes that break down collagen. As collagen breaks down, cartilage thins out, and this, along with other factors, can cause pain, inflammation, and stiffness, which are all classic symptoms of osteoarthritis. Now, collagen supplements are usually thought to help by providing the building blocks or amino acids needed to repair and maintain cartilage. But collagen supplements come in two main forms: hydrolysed collagen, called HC, and undenatured collagen, called UC. They work in completely different ways. Most people don't realize that hydrolysed collagen and undenatured collagen are not the same thing, and they actually work in the body in very different ways. Hydrolysed collagen, also known as collagen peptides, is collagen that has been broken down into smaller pieces or peptides, so your body can absorb it more easily. The idea behind hydrolysed collagen is that these smaller peptides are digested, absorbed into the bloodstream, and can then travel to your joints, where, under favorable conditions, the cells in your joint can use these as building blocks and maybe help rebuild cartilage and reduce inflammation. In the study, researchers noticed that hydrolysed collagen supplements showed some improvement in pain and function for people with knee osteoarthritis, but the results did vary from study to study. Hydrolysed collagen provides the raw materials your body needs to repair damaged cartilage. But hydrolyzed collagen does not magically rebuild your joints overnight. It's a slow process, and the research suggests you have to take it consistently over a long period, like up to 24 weeks or even more, to see noticeable benefits. And then other factors like diet, physical activity, strengthening exercises can help or hinder this process. Now, undenatured collagen, often called UC2 collagen, works quite differently. Unlike hydrolyzed collagen, undenatured collagen is not broken down into smaller pieces. Instead, undenatured collagen is believed to work through a process called oral tolerance that impacts your immune system. Here's how it works. When you take undenatured collagen, it triggers a specific immune response that calms inflammation in the joints. By calming down the immune system's attack on the cartilage, undenatured collagen helps to slow down the breakdown of cartilage. It's like turning off the body's inflammatory response that's contributing to the joint damage in the first place. The study found that undenatured collagen might have a stronger effect on inflammation compared to hydrolyzed collagen, making it more effective for reducing pain and stiffness in some people. However, undenatured collagen doesn't provide the building blocks like hydrolyzed collagen does. It's more about reducing inflammation and slowing the progression of cartilage damage. So what type of collagen should you choose? Well, that depends on what you're hoping to achieve. If you're looking to reduce inflammation and slow the progression of osteoarthritis, then undenatured collagen might be the better option for you. It targets the immune system and helps prevent further cartilage breakdown. Reducing inflammation can lead to less pain and more function. It's also important to know that undenatured collagen is best taken on an empty stomach before bed. So you want to be sure that you can fit that into your schedule. If you're hoping to repair cartilage and provide the body with the raw materials to rebuild joint tissue, then hydrolyzed collagen could be the better fit. But remember, it is not a quick fix. You need to be consistent for several months and couple it with the right lifestyle choices to potentially see results. Both forms of collagen have shown statistically significant improvements in osteoarthritis symptoms in this new meta-analysis, but it's important to manage expectations. Neither hydrolyzed collagen or undenatured collagen are miracle cures, and they're not a substitute for foundational treatments like diet, regular physical activity, and other lifestyle modifications. I'd also like to mention that both types of collagen are considered safe. The study reported very few adverse effects, and the side effects that were noted, like a mild headache or digestive discomfort, were rare. However, it's still always a good idea to consult your doctor before starting any new supplement, especially if you're already managing a condition like osteoarthritis. Now let's get back to the study itself. What did it actually find? The meta-analysis pooled data from 11 clinical trials with a total of 870 participants, all of whom had knee osteoarthritis. The researchers looked at two main outcomes: pain relief and improvement in joint function. The meta-analysis showed that overall, collagen supplements led to a significant reduction in pain compared to the placebo group. A standardized pain scale was used, and the pain reduction experience was considered clinically meaningful by the researchers. So in simpler terms, this means that people felt less pain after taking collagen, especially those who took it for longer periods, like 24 weeks or more. When it came to joint function, the results were also positive. People who took collagen had an improvement in their overall function on something called the WOMAC scale. This showed a real improvement in mobility and daily activities like walking, standing, and climbing stairs. So what does this mean for you? If you're already making healthy lifestyle choices like regular movement, a healthy inflammation-fighting diet, managing your weight, maybe even doing some physical therapy, collagen could be a helpful addition to your routine. But it's important that you see it for what it is. A supplement to a broader treatment plan. It is not a cure for osteoarthritis. A lot of people tend to overestimate what supplements can do, but the truth is the best outcomes for osteoarthritis come from a multifaceted approach. Adding collagen into this mix might enhance your results, but it won't replace the other changes needed to improve joint health. So to wrap up, if you're thinking about trying collagen for your osteoarthritis, the evidence does suggest that it can help, especially with pain relief and joint function. But it's important to be patient and realistic. It can take months of consistent use to see results, and collagen is not a stand-alone solution. Hydrolysed collagen and undenatured collagen each have their benefits. Hydrolysed collagen provides the building blocks for cartilage repair, while undenatured collagen helps to calm inflammation and slow cartilage breakdown. The choice between the two depends on your personal needs and what aspects of your joint health that you want to focus on. And remember, lifestyle changes remain the cornerstone of osteoarthritis management. And while collagen may offer some benefits, it's just one piece of the puzzle. If you want more information on making lifestyle changes that will improve your osteoarthritis, look in the video description for a link to my Live Well with Osteoarthritis course. If you found this video helpful, please hit that like button and subscribe for more content on improving your osteoarthritis. Thanks for watching, and I'll see you in the next video. Until then, take good care of yourself and remember that the small steps you take every day can lead to big improvements in your joint health.